What is respiratory disease? Different types of disease and treatment question and doctor advice. While there are less respiratory problems for your bird to contract due to improvements in bird care and the results of research, common diseases such as bacterial and fungal pneumonia, aspergillosis, and others remain a common threat. Early diagnosis is vital to catch any disease or condition in its early stages, preventing it getting established and damaging vital organs. With ongoing research, there are many new developments in the field of respiratory disease in birds. Engaging the help of an avian doctor who specializes in the field of bird health is vital to the success rate of recovery. Respiratory diseases in birds are similar to the common cold, but are considered infectious diseases that are caused by a diverse range of pathogens. Symptoms of respiratory disease in birds. Other disorders can mimic respiratory illness, which is why it is important to get your avian veterinarian's assistance. Labored breathing. Dyspnea after your bird undertakes a short flight. Tail bobbing, which is a rhythmic jerking of the tail. Frequent sneezing combined with nasal discharge. A change of your bird's voice may be noticed. Panting after a short bout of exercise. Coughing. Wheezing sounds. Periocular swelling. Causes of respiratory disease in birds. Environmental factors can cause respiratory disease in birds. These factors can include overcrowding, malnutrition, long-term antibiotic therapy, and poor ventilation. Toxic fumes inhaled by birds can be a factor, including hairspray, ammonia, cigarette smoke, overheated Teflon, and self-cleaning ovens. Bacterial infections such as chlamydophila, fungal pneumonia. Hypovitaminosis is a deficiency of vitamin A which can result in changes to the respiratory epithelium, allowing bacteria, viruses, and fungi to enter your bird's body. Tracheal foreign bodies such as a seed, piece of toy, or abnormal tissue growth can cause difficulty in breathing and needs emergency attention by your avian specialist. Klebsiella, Proteus, Chlamydophila, and Pasteurella, all of which are severe and very serious. Aspergillosis disease is a fungal disease affecting the lungs and respiratory system, and is particularly infectious when your bird's immunity is low. Large indoor flocks of birds have a higher risk of getting bacterial and fungal infections due to the poor ventilation compared to outdoors. Your indoor birds are susceptible to breathing in airborne toxins such as household cleaners, incense, and air fresheners. Damp environment with decaying vegetation and contaminated seed causes fungus growth. Diagnosis of respiratory disease in birds. When your bird is having a hard time breathing, the best response is to take it to an avian veterinarian for treatment. Birds are notorious for hiding their illness due to an inbuilt survival strategy because a sick and disabled bird is one that attracts predators. Fortunately, with a respiratory illness, the wheezing and sneezing will give it away. Your avian doctor will examine your bird to determine what is causing the respiratory system to become infected. He will typically determine the cause of the condition through laboratory culture of mucus. He will ask about your bird's environment and diet and do a physical examination of your bird. An examination of your bird's air sacs for inflammation, which is a sign of versiculitis, may reveal congested air sacs and lungs with white mucus and nodules. With any infection, it is important to treat it immediately before the condition gets to an advanced stage. Treatment of respiratory disease in birds. With early diagnosis and if treated in the early stages of a disease or infection, the prognosis is good. Just recently, specialists have used a bronchodilator to treat birds with severe respiratory distress. The bronchodilator works by relaxing the smooth muscle around the bronchi, opening the bronchi, and letting more air pass into the deeper tissue for oxygen exchange. If your bird doesn't respond to intramuscular administration, drugs like terbutaline can be used via a nebulizer. In the case of bacterial infections, supportive care and antibiotics are the treatment to use. A larger number of specialists are now using the nebulizer to enable effective delivery of the medications directly into your bird's respiratory system. Antibiotics, steroids, and antifungals are used depending on the diagnosis of your bird's condition. The main thing is getting your bird into treatment in the early stages of the illness. Advanced disease is harder to maintain and treat. For aspergillosis, there have been several new developments in medications for the treatment of this disease. Lamisil is a very safe drug and is appropriate for long-term therapy. Because of the variety of causes of respiratory disease in birds, it is hard to define all treatments here that are available. The best solution is to consult with your avian doctor. Recovery of respiratory disease in birds. As in all illness, prevention is always best. If your bird lives inside, being aware of how sensitive your feathered friend is to airborne toxins is vital. Spraying air fresheners or lighting incense can hurt your bird and can initiate a respiratory response. Good ventilation, clean living conditions, and monitoring your pet's health will keep infections in check. Early diagnosis and an effective long-term treatment will maintain the health of your bird. A sick bird requires a calm environment, plenty of rest, and good quality food to enable treatment to be effective. Respiratory disease questions and advice from veterinary professionals. Question: my 10-year-old pied lovebird has developed something like a sore just above her beak. She is still active and loves to be scratched and held, and is still very vocal. There may be a small growth coming out onto the beak. There really are no other symptoms evident. Recommendations: Dr.michele, k.dvm. Recommendation ribbon. 0 recommendations. It would be best to have Jasmine seen by a veterinarian, as I can't see the growth of determine what the cause might be. Having her seen and examined will allow the growth to be looked at and have appropriate treatment for her. Question. My cockatiel has recently recovered from liver disease. However, he is always tired and yawns like 20 times in one go. He is also very inactive nowadays, whereas before he was very active. He also has become very quiet and only chirps sometimes, whereas before he was always singing if you're happy and you know it, clap your hands, and now he barely ever chirps. The only thing he likes doing is sleeping, and he is constantly itching near his throat. The skin there is quiet, flaky, and also very pink. I had an appointment with the vet last Monday and he said that my bird is well on the way to recovery, but these are some symptoms that I find quite hard to ignore, especially when I have been reading around the subject and it is associated with respiratory diseases. I do really appreciate some help. Recommendations. Birds are very sensitive to start with and any recovery will take some time. If your veterinarian has noted that Prince is on the road to recovery, I would recommend that you follow their guidance and monitor for improvement. Without examining Prince myself, I cannot say whether there is any other underlying cause or a reason to be concerned. Regards, Dr. Callum Turner, DVM. Question. I purchased a budgie 2 days ago from the local pet store. I have several others from that store that are healthy and boisterous. This bird seemed the same, but 24 hours after coming home I noticed his tail bobbing. He eats and drinks normally, preens and flies with the others. The tail bobbing does not stop, even during rest. There is no discharge around his cere. He doesn't have diarrhea and his waist is normal colored, but it is softer than my other birds and sometimes sticks to his feathers near his vent. There is a slight sound when breathing when close to my ear. I am concerned about infection. The store said all birds are vet checked before they are available for sale, but I am worried about respiratory infection. I tried to schedule an appointment with the vet and found out the avian vet no longer practices here. The nearest vet is many hours away. I have 5 other budgies and none of them have done this. I am concerned for the new bird as well as my current birds. The new bird is in a separate cage, but my other budgies have come in contact with it through that cage while I was at work and my teenagers let him out. What can I do to help this bird when the vet in town left? If I had known, I wouldn't have gotten any additional birds. Recommendations. Whilst your local avian veterinarian isn't available, a general veterinarian would still be able to examine Finn and advise you on what they are seeing. The loose dropping may be due to a new environment but should be considered when examined. If Finn was normal when he arrived home, there may be an irritant affecting him in your home, but I cannot say with certainty without examining him. You should visit a general veterinarian for an examination and then decide from there. I have also put a link to a directory of avian veterinarians in case there is one on the list closer to you that you were unaware of. Regards, Dr. Callum Turner, DVM. www.av.org/search/custom.asp/